I am Dr. Satinder Kaur, Senior Consultant and Clinical Lead Gynae Oncology, Dharamshila Narayana Superspeciality Hospital, Delhi. So, average age of menopause, that is cessation of menses or the stoppage of periods, is 50 years in Indian women. Any bleeding that occurs 6 months to 1 year after stoppage of your periods is called postmenopausal bleeding. It is very important because 10% of these cases will be associated with some form of endometrial or cervical cancers. That is why so much stress is laid upon any bleeding on postmenopausal range. However, the problem is most of the times patients are not able to assess from where the bleeding was. They usually see a spot of blood on their undergarments or on the pot, and they are not able to make out whether the bleeding was from vagina or from some other route. Like the bleeding can happen in case of piles from the rectum, or it can happen in case of urinary infection from the urinary tract. So in case you notice any postmenopausal bleeding, the first step is to go to your doctor, go to your gynecologist and get yourself examined so that we can know the source of the bleeding. So once we know the source, and if it is a vaginal bleeding, it needs further evaluation. As I said, 10% of the cases are associated with cancer. However, we must see the positive aspect. There are 90% in which there is no cancer. But we do not want to miss those 10%, and that is why evaluation is must. Most of the times it is because of the hormonal deficiency that the lining of the uterus or the vagina becomes very thin, and even in case of minor trauma or without a trauma also it starts to bleed. So that is why which will just need some form of local therapy and not any further evaluation. Apart from that, there can be some polyps in the endometrium cavity, there can be some hyperplasia, which that is the lining becomes very thick, which needs evaluation. So in case of any postmenopausal bleeding, your gynecologist will further advise you tests like a pap smear for the cervix and an ultrasound examination to see inside the uterine cavity to rule out any abnormalities. So based on the initial evaluation, you may further be advised a biopsy, which can be from the uterus or the cervix. So biopsy in these cases does not lead to spread of the disease. So it is important that the biopsy be done so that we can know whether there is actually a cancer or not. And once the diagnosis is made, you might need further evaluation like an MRI or a CT scan to see the spread of the disease. The treatment is dependent on that. So if it is not a cancer, which will happen in 90% of the cases, you may not need a removal of the uterus, but yes, you may need minor procedures like removal of polyps, or you may just need some hormonal therapy for the treatment, or you may just need to stop some drugs which may actually be leading to the bleeding. So for every case, it is not the cancer, but you need to get evaluated. So reaching the doctor in right time and to a right doctor is your responsibility. So any postmenopausal bleeding, please meet your doctor at the right time early so that you can be evaluated.